Well, here we go again. Once again, Planned Parenthood is under attack. A bill is before the Senate that would once again attempt to defund Planned Parenthood. And once again, we're seeing the Republican majority put their partisan agenda ahead of the health of women. For 100 years, Planned Parenthood has been a trusted provider of health care services. Last year alone, Planned Parenthood of Northern New England served 12,000 women in New Hampshire. Most of them are low income. And for many women in my state of New Hampshire, the full range of health services offered at Planned Parenthood is the most affordable and accessible way for them to get the care they need. 94% of the services provided by Planned Parenthood in New Hampshire are prevention related. And we can see on this chart, it's well women visits, cancer screenings, vaccinations, birth control, breast exams, HIV tests. Planned Parenthood provides the health care that so many women need to ensure that they can live their lives in a way that gives them opportunities and gives them reassurance that they're going to have their health. I oppose the legislation that has been introduced to defund Planned Parenthood. It would make it harder for millions of women, as I said, 12,000 in New Hampshire last year alone, to get the high-quality, affordable care that they need. And this attack on women's health is politically motivated. It holds hostage the millions of women and families who depend on Planned Parenthood. The highly edited videos that have been circulated are disturbing. Planned Parenthood has apologized, and the secretly taped videos and Planned Parenthood's practices are under review by the Department of Justice. That's appropriate. But make no mistake about it, the group that's responsible for these deceptive videos is motivated by a single purpose: to limit access to abortion services. Its three officers are prominent in the anti-abortion movement. They have ties to many other politically motivated groups that are working to take away a woman's right to choose. They've been tied to organizations that harass medical providers, doctors, try and limit access to women's health care clinics, and they actively work to limit the reproductive health care decisions that a woman can make. Now, federal dollars are already prohibited from being used to pay for abortion under the Hyde Amendment, except in cases of rape, incest, or when the health of the mother is threatened. So this is not a vote to defund abortion. This is a vote to defund preventive health care for women, the kinds of things that are outlined on this chart: the cancer screenings, the vaccinations, the breast exams, the HIV tests, and birth control. You know, if you don't like abortion, then you should support family planning, which is one of the things that Planned Parenthood does. And by targeting Planned Parenthood, this politically motivated attack on women's health will limit access to health care services that I think we all agree should be available, the kinds of services that are listed on this chart. On behalf of the millions of women who are served by Planned Parenthood and the thousands of women in New Hampshire, I oppose and I will continue to oppose any attempt to defund Planned Parenthood, an organization that is absolutely a critical component of women's health care. So thank you, Mr. President. I yield the floor.